When you do the pole test or the atlas or the first cervical vertebra, C1, you also have to test C2 or the axis as well, which is the second neck bone. What I'm doing over here is extending the horse's head up to each side. The side that feels heavier going up is the side, again, where the atlas or the pole is sore. But you also have to test C2. Now C2, the second neck bone, allows for head rotation. If your horse cannot bend his head to the right or left, that means there's a problem with C2. If you can't pull your horse's head to the right or left, that means there's a problem with C2. And right over here, I'm doing what is known as the active range of motion test to see if the horse minds bending to one side, just doing the carrot test or the active range of motion test. And then I would test C2 separately by putting my hand on C2 on each side and then bending the horse's head, which is lateral flexion, nose to the shoulder. The side that has less lateral flexion is the side where the second neck bone is sore. So here I'm still doing the active range of motion test or the carrot test, and then I'm going to test C2 separately. So first I want to test C2 on the right hand side just to show you where it's at. So I put my hand on C2, bend the horse's head into my hand, the neck into my hand, and then I'll test C2 on the left hand side. Again, the side that has the most resistance when I'm doing this test is where C2 is sore.